Good evening, sir.
Good evening to all. This is Chandramohan, ortho-physiotherapist from Sri Samraj Physiotherapy Center, Dindivanam, Tamil Nadu. A warm welcome to all for the ExRx India's and Sri Samraj Health Services Private Limited's presenting a WEBATHON web series. Enthusing for the world record, not just counting only the topics, but also providing the knowledge for the physiotherapists in India and 23 countries. And also providing online OG consultation for the women's health related issues in association with Peak Health Studio, Chennai, Dusar Creations, West Bengal, powered by Fitness and Rehab India YouTube channel. ExRx India's 192nd topic is prevention and promotion of health, that is osteoporosis, will be presented by Dr. N. Bobby, MPT Ortho and PhD. Now I welcome ExRx India's team members, Dr. Rupesh and Professor Duna. And now I welcome our resource person, Dr. N. Bobby, and request her to commence the session. Please, madam.
Happy evening to all the participants of Happy Learning section. First of all, I would like to thank Dr. Chandramohan sir, who has given me this wonderful platform. And I also thank entire ExRx team for making me in this section. Thank you, sir. Thank you, ma'am. Let's begin the section. Today's topic is prevention and promotion of health in osteoporosis. Before we are looking into the prevention and promotion, let's have a brief description about osteoporosis. Osteoporosis is a Greek word, osteon meaning bone and porosis about hole. Osteoporosis is characterized by low bone mass. It is a microarchitectural deterioration of bone. The porous bone will be like a compressive and gives the appearance of the spongy look. Next. When we view under the microscope, the healthy bone gives the appearance of honeycomb. When the bone is osteoporotic, this space, the holes and space in between the honeycomb will become much larger than the healthier bone. So as a result, the bone become less dense and it get weakened and more likely susceptible to the breakage that we considered as a fracture. Next. By definition, By definition, osteoporosis is a reduction in the bone strength leading to the increased risk of fracture. The WHO has given a standard osteoporosis definition, that is, the individual will have a less score, that is, T-score will be minus 2.5. The person who is having a T-score of minus 2.5 will be considered as an osteoporotic person. Next. When we see for the bone is made of collagens and protein. This collagen and protein makes the bone, forms the matrix in the bone. That matrix will be like a soft framework. This soft framework will become hardened when calcium phosphate and minerals is added to it. The combination of this collagen and calcium makes the bone more flexible and strong, which in turn helps the bone to withstand the stress. 99% of the calcium will be present in the bone and teeth. The remaining 1%, it is found in the bloodstreams. Throughout our lifetime, This bone growth is the formation of bone and removal of bone. Both the process will be occurring throughout our life. The bone formation will be seen peak in the childhood, teenage, and in the 20s. As age goes, the bone loses its strength. The period of resorption of bone started occurring. The bone formation is very peak by the 20s. Osteoporosis like to develop when it does not reach the optimal peak bone mass during this 20s. Next. There are three types of cells: osteocytes, osteoclast, and osteoblast. Osteocyte is purely responsible for the bone resorption, and this osteoclast is the exclusive bone resorbing cells. In the case of osteoblast, it is responsible for the mineralization of the bone matrix. The two things should be very important in the case of a bone. One is the bone formation and the other one is the bone resorption. Bone resorption is helped with the help of the cells osteocytes and the osteoclasts, and this bone formation will be helped with the help of the osteoblast cells. Next. On seeing the pathophysiology, the two factors should be taken into the consideration. One is the peak bone mass and the other one is the bone remodeling. This peak bone mass is seen by the 20s. As we saw in the bone formation, the peak bone mass will be maximum at the age of 25 to 35. It is nothing but the peak bone mass is the maximum mass of the bone achieved by the individual at the skeletal maturity. During this stage, this matrix of the bone will become very harder, thicker, and stronger. As the peak bone mass is reached, both men and the women started losing their bone mass throughout their remaining life period. So this is the very important stage in the bone formation. There are certain factors which determines the peak bone mass is. One is the genetic factor, the next is the nutritional status and the physical activity. During this 20s and 30s, the physical activity is very much important because this physical activity like exercises will start improving our muscle strength. At the same time, our dietary factor will also play an important role in forming a bone by improving the calcium intake. Next. The second thing in the pathophysiology is bone remodeling. There are two main functions of bone remodeling. One is on the skeletal system and the other one is on the bloodstreams. In the skeletal system, it helps in repairing the micro damage. In the case of bloodstream, the calcium is maintained in the blood, in the serum calcium level. These two functions are very important during the stage of bone remodeling. For the bone remodeling is regulated by some hormones which includes estrogen, androgen, vitamin D, parathyroid hormone and growth hormone. All these hormones will play their important role in the bone remodeling. Usually in the late 40s, the women will start losing their getting disturbed with the hormonal imbalances. These imbalances will lead to the osteoporosis. Osteoporosis results not only because of the age factor, but it is also plays the role in the extrinsic and intrinsic factors like this hormonal variation and the bone formation, that is reaching the peak optimal bone mass. There are two types of osteoporosis. One is a primary osteoporosis and the other one is a secondary osteoporosis. This primary osteoporosis has two types. Type 1 is postmenopausal osteoporosis and the type 2 is age-associated osteoporosis. In the case of type 1 primary osteoporosis, this postmenopausal osteoporosis occurs because of lack of estrogen, that is a hormonal imbalance, which leads to the increased bone resorption. Next. The primary osteoporosis in the type 1, the postmenopausal osteoporosis, and type 2, the age-related factor, both will increase the bone loss, which leads to the low bone density and which can cause the fractures, that fracture will be considered as a osteoporotic fracture. The other type of osteoporosis is the secondary osteoporosis, which occur secondary to some conditions, either a inflammatory disorder or a intake of corticosteroids drugs. Few times what happened, the patient is not susceptible to the osteoporosis, but they slowly develops the osteoporosis because of other conditions. Next. In the secondary osteoporosis occurs because of certain conditions which involves the endocrine gland, the hyperparathyroidism, insulin-dependent diabetes, and adrenal insufficiency. As we saw, this postmenopausal osteoporosis is a hormonal imbalance. So this hormonal imbalance will also lead to the osteoporosis. Second is the drug intake. In certain conditions, we take drugs like glucocorticoids, heparin, anticonvulsants, and immunosuppressants, which is necessary for that particular condition, but as an intake of longer duration, the person will slowly loosening its bone strength and the condition of osteoporosis started occurring. And the third is chronic diseases like rheumatoid arthritis, polyarthritis, all the inflammatory conditions, or renal impairment, and a liver cirrhosis, because the metabolism will be getting affected. In these situations also, the person will start getting the osteoporotic symptoms. Apart from all this, the secondary osteoporosis has one main factor, that is nutritional deficiency, which plays the very important role in the formation of bone. When in the teenage and in the 30s, the individual is malnourished, this bone formation will not reach the peak bone mass. So the bone formation will also stop, and the next stage of bone resorption will start occurring before reaching the peak bone mass. So the bone is not harder, stronger enough to sustain the external stresses. Next. When we see the causative factor for osteoporosis, it might be hereditary and congenital, and the next one is like acquired. This hereditary and congenital will be because of the conditions like osteogenesis imperfecta or any gonadal dysgenesis. In the case of this acquired, again it has the two causative factors. One is a primary causative factor and the secondary causative factor. As we saw the types of osteoporosis, there are two types, that is the primary and the secondary. This primary will be considered as the postmenopausal and the age-related osteoporosis. This causative factor will be the postmenopause and the age factor. In the case of secondary causative factor, nutritional deficiency or sedentary lifestyle of the individual without any physical activity, or there is no exercise till the older age, the bone may not be strength enough to hold the external stresses. And habit of smoking or alcoholism. This both can also have the impact on forming the in controlling the bone formation. And certain drugs. Already we have seen the drugs like the anticonvulsant or glucocorticoids, when it is taken in a larger consumption for a longer duration, that will also have the impact on the reduction in the bone formation. Apart from that, in the acquired, there is one more causative factor, is a localized causative factor, which comes under the secondary osteoporosis. That secondary osteoporosis is occurring because of some conditions after to the conditions like the inflammatory conditions or after any fracture. When the individual is getting fractured in his adulthood, after the rehabilitation period, slowly the strength of the bone will be reduced if the proper rehabilitation is not done. All this will be considered as a primary and a secondary causative factor for the occurrence of osteoporosis. Next. Now comes the clinical signs and the symptoms. The clinical features for osteoporosis: it is a silent disease. It is not recognized till the individual get fractured his bone. Few times what happen is the person never have any of the symptom. He or she never feel any pain or any discomfort. Here he would have not recognized he is going osteoporotic. Once he get fractured and he is diagnosed, why this fracture occurs, the causative factor behind will be coming as a osteoporotic symptom, that is the low bone mass. Few times what happened, the patient will feel the back pain, that the area will be the lower thoracic or higher lumbar region. When an acute pain of back occurs for a longer duration, it has to be taken into consideration. If it is neglected for a longer time, it may lead to the compression fracture of the vertebrae. Usually, this osteoporosis is commonly seen in the spinal vertebrae, hip joint, and in the wrist. Due to severity of the osteoporosis, without any trauma also, the vertebrae can get damaged and gradually it moves towards the fracture, that is a compression fracture of the vertebrae. When without any sign, when this vertebrae is getting fractured, the pain will be very peak and very severe. The individual will never able to tolerate this severe pain. At that time, they will be moving to the physician and they will be diagnosed as a fracture, and the cause will be detected as a osteoporosis. And the next sign we can see is a decrease in height. The individual will be normal and all of a sudden he may feel the changes, like comparing to 6 months or 1 year, he is getting shorter. That is the height variation. Previously, I was not this much short. Slowly, I started getting a reduction in the height. Likewise, the height, the weight of the individual will also be reduced because of the low bone density. And the next clinical sign will be the kyphosis posture. Gradually, the upright position of the individual will be becoming as a stooped posture. The individual started bending forward and developing a rounded back. We call that one as a kyphosis. And Dwager's hump. It is nothing but the stooped posture in which the anterior vertebrae will be compressed. We saw in the introduction, due to the porosis, the vertebrae will be flexible, will become compressive and gives the spongy appearance. This occurs in the vertebrae when the individual develops the Dwager's hump. And the next is the decreased activity tolerance. The decreased activity tolerance, uh, the individuals come with a back pain and they will be complaining about the back pain. Along with that, when we take the history, they will be saying, previously I was doing the activities very briskly, but the same activities, even the personal activities, I am getting disturbed. I'm unable to do the personal activities also. I'm getting tired soon. I'm unable to work hard like previous. All these things will be considered as the decreased activity tolerance. And next is about the bone fracture. As we said, it is a silent disease. It never shows the symptom till the bone get fractured. So most of the individual come with a fractured bones like in the spine, hip and wrist. And after it will be diagnosed as the cause for the fracture is considered as the osteoporosis. This will also give the impact of osteoporosis. And next is when we take the X-ray of the such bone, osteoporotic bone, it gives the compressive spongy appearance. And all this will help in finding the signs of the osteoporotic individual. One is like a severe back pain without any trauma or strain, and the loss in the height, loss in the weight, decreased tolerance. So all this will be considered as a signs and symptoms of osteoporotic patient. Next. Now we look into the risk factor for osteoporosis. The National Osteoporosis Foundation has given some guideline for the osteoporotic fracture, which includes cigarette smoking, low body weight, alcohol consumption, estrogen deficiency, prolonged amenorrhea, yearly menopause, lifelong low calcium intake, recurrent fall, poor health, inadequate physical activity, and family history. They have given a guideline regarding all these factors. The reason is when the individual is having these factors, he can be susceptible for the osteoporosis. Mainly we saw it is a hormonal imbalance. When the individual or a woman having a estrogen deficiency, he can be susceptible for the osteoporosis. Likewise, in the women, the prolonged amenorrhea, it is very common after 40 in the females. When the amenorrhea is prolonged more than a year, it has to be taken into consideration because it gives the sign of the osteoporosis. Likewise, the yearly menopause below 45 years. Previously, the previous generation women will have their menopause around 50 or above 50 years. In this sedentary lifestyle, nowadays the women are getting a menopause period before, like in the early 30s or in the late 30s or in the 40s, early 40s. All this is like a symptoms for the finding of osteoporosis. Apart from that, recurrent fall. In the recurrent fall, what happened? The bone will get fractured, and uh, frequently what happens, the bone formation and the bone resorption, both the process will be taking in taking process. The bone formation will be reaching the peak bone mass, like making the bone harder. In the case of bone resorption, it is a process in which the calcium will be removed from the bone and it will be transferred into the bloodstreams. If this both the process frequently occurs, the bone will started losing its bone strength and leads to the osteoporotic condition. And the inadequate physical activity. Due to sedentary lifestyle, we lack our physical activity. Most of them will never have the regular exercise schedule. So the muscle mass is not built up and which is not protected to the bone also. So which can be one of the high risk factor for the risk factor for the osteoporosis. And finally comes the family history. If the previous generation has the osteoporosis, we can expect the next generation will also be having there is a chances for the osteoporosis, but it can be overcome. There are next. These risk factors are given by the National Osteoporosis Foundation as a guideline to find out the osteoporosis. But these risk factors are divided into two. One is like a non-modifiable risk factors and the modifiable risk factors. These non-modifiable risk factors we can't change and it is not altered. It will have the impact on the individual's lifestyle, which includes age factor. We can't stop the age factor. And the next one is the female gender. In the prevalence, females will be more affected comparing to the men. So this female gender will be having a high risk factor. And the next one is a premature menopause, that is below 45 years. The menopause period below the 45 years, it will not be changed. And after that, the bone resorption will start occurring and the female will be facing a problem of osteoporosis in the bone. And the next factor is like a family history. It is a primary factor which we cannot be changed, which we cannot modify. And a personal history of frequent fall. All this is like a non-modifiable risk factors. When it happens, we can say the individual is prone to the osteoporosis. And there are certain risk factors which we develop and it can be modified and we can overcome this osteoporosis, which includes the calcium and vitamin D intake, either as a dietary or as a supplements. When the individuals in the teen or 20s and teen, they doesn't have a good habit of nutritional intake, they can be susceptible for the malnourishment. When it happened, that is the peak period for the bone formation. When that time there is not much nutritious supply, the bone development is also will not reach the bone peak mass. So when the dietary change we do, either in the supplement or in the oral intake, it can be modified and we can overcome this osteoporosis. And the second one is like a sedentary lifestyle. Sedentary lifestyle. Now in the fast moving life, we are not concentrating on a personal health, doing a regular exercise, which will be having an impact for the bone formation. After we get some condition only, we will start getting awareness and we will start doing the exercises. But it is advised from the earlyhood, from the teenage and the 20s, if we start doing the exercises, that strength of the bone will be very, very stronger. And other things like quitting the smoking habit and excessive alcohol intake. Uh, there is a research that excessive caffeine intake, that is more than 3 drinks per day, will also leads to the osteoporosis. This nicotine will be affecting the, this nicotine will help in resorption of the bone. As the bone resorptions occur, this calcium will be removed from the bone and it will be pushed to the bloodstreams. So automatically bone loses its strength and moves towards the osteoporosis. And next is the low body weight. When a body weight is below 19 kgs, the the mass of the density of the bone will not be that much thicker or harder. The matrix, the bone matrix will never be harder enough to sustain the external stress. And apart from that, estrogen deficiency, hormonal imbalances, which is acquired because of irregular periods or recurrent fall, that all we can taken into consideration for the modification of the risk factor, by which we can try to overcome with the osteoporosis. Next. Physical examination. There is a certain physical examination which helps in finding the individual is moving towards the osteoporosis. That is, from the clinical features, we have seen that it has a reduced height and loss in weight. All of a sudden, the individual will become will be reduced in his height, and in the same case, the weight will also be reduced because of the bone mass loss. Slowly, the individual will start developing the stooped posture. That stooped posture will be observed physically as a physical examination. It is found as a kyphotic posture. Likewise, the individual will have the complaint of tooth loss and thickening in the skin fold. Apart from this, the grip strength. Few times, the maximum the ladies who is coming with the complaint of back pain, they used to say even they are getting pain in the hands and wrist, and the grip of the hand is also reduced. Like even lifting a small vessels, it is slipping from the hand and falling down. That shows the grip in the hand is also slowly reducing. The height loss, body weight, the loss in weight, kyphosis, tooth loss, and grip strength. These three will be considered as a physical examination. Apart from this, we saw osteoporosis is a silent disease which is not diagnosed till the bone get fractured. So few times what happened, the individual comes with a severe back pain. That back pain will be because of the compressive fracture of the vertebrae. So how we have to make a physical examination is two examinations. One is the wall occiput distance and the other one is the rib pelvic distance. Next. In the case of wall occiput distance, the individual is instructed to stand on the wall. The distance between the wall and the occiput is measured. Usually, it will be a 0 centimeter or 1 centimeter. When it exceeds 5 centimeter, then we can have the conclusion the thoracic vertebrae is gone for the compressive fracture. Likewise, pelvic rib distance. When the patient is instructed to stand and we measure the distance between the pelvic rim and the rib cage, it will be a 4-finger breadth. When it reduces to 2-finger, it is considered as, it can be easily considered that the thoracic vertebrae has gone for the compressive fracture. So these two examinations will help in finding the vertebral fracture, even though the patient is not aware of the fracture. They only complain about the severe pain in the back and it is intolerable. With this examination, we can able to find out whether the vertebrae is gone for the compressive fracture or not. Next. Diagnosis. The diagnosis through laboratory test. We saw the 99% of the calcium will be present in the bone and the teeth, and the 1% will be present on the serum calcium as a serum calcium. So laboratory test will help in finding the serum calcium level, and 24 hours urine test. And apart from that, we saw it is a hormonal imbalance, so thyroid function test and parathyroid hormone level will also help in finding this osteoporosis. Apart from this vitamin D test plays the main role in finding the osteoporosis, because this vitamin D is responsible for the absorption of calcium in the bone. When this vitamin D is reduced, the absorption of bone in the, we saw the bone is formed with the help of the collagen, and when the calcium is added to this collagen, the bone becomes stronger. For that, the absorption of calcium is required for the bone. That absorption is helped with the is performed with the help of the vitamin D. So when we take vitamin D test, if it is reduced, then we can able to diagnose the osteoporosis. Next, X-ray. We saw two types of osteoporosis. In that, the primary osteoporosis has the two types. The one type is about the postmenopausal osteoporosis. In the case of postmenopausal osteoporosis, the trabecular resorption and cortical resorption will be present. We all know about the trabecular system, which consists of principal compressive group and a principal tensile group. Apart from that, secondary compressive group and the secondary tensile group. This compressive group of trabecular system and this tensile group of will be crossed with the help of the tensile group of trabecular system to form the stronger bone. In between this trabecular system, there is an area called a Watt's triangle. In a healthy bone, next. In a healthy bone, this trabecular system along with the Watt's triangle will be seen on the radiograph as the white markings or as the white lines. This picture 2 showing 1 and 2 is primary principal tensile group and principal compressive group, showing the trabecular system. In the third figure, this arrow marks, the upper arrow mark shows the Watt triangle that will be shaded as a dark triangular area. This white shaded area will be the trabecular lines, trabecular system lines. In between this both primary and the secondary compressive trabecular system, this mid darkened area is considered as a Watt triangle. The healthy bone will have this appearance. In the case of osteoporosis, this dark triangular area is not visible, and even the trabecular systems is not visible. The picture will be like a plain whitening. Next. The next test is the bone mineral density. This bone mineral density is a common test for finding out the osteoporosis. It has the T-score. In the definition, WHO has given a standard definition regarding this T-score, that the T-score below -2.5 will be considered as the osteoporotic symptom. So this T-score contains the value of 1, which is considered as a normal individual. When it is -1, it is considered as a osteopenia, and below -2.5, it is considered as the osteoporosis, and less than -2.5 score is considered as a severe osteoporosis. With this, we can come to the diagnosis of osteoporosis with the help of the T-score. Next. Next. There is a tool, fracture risk assessment tool, FRAX, which helps in finding the accurate probability, 10 years fracture probability of hip and major osteoporotic fracture risk. This tool helps to find the 10 years of fracture possibility in the osteoporotic patient. Even though the patient is osteoporosis, they never undergo with the fractures. Whether the individual is susceptible for fracture or not can be identified with the help of this assessment tool, that is fracture risk assessment tool. It helps it influences the individual's bone quality and also the bone density. Next. This questionnaire contains age, sex, height, weight. As we saw, the height and weight of the individual will be reduced in the symptoms. Apart from that, ageative factor will also be playing the role. So all this will be taken into the consideration. Apart from this age factor, height, weight, and gender, we saw some modifying risk factors which will be taken into consideration in this questionnaire. All these questions will be answered as a yes/no type, and the final calculation will be taken into consideration, and it will be found out that whether the individual is susceptible to fracture in the next 10 years or not. Next. The prevention and promotion of health. Good nutrition, regular exercise, lifestyle modification, and proper education to the individual helps the bone keep the bone healthy throughout the life. So the prevention should be concentrated towards the certain factors like body weight. We saw the low body weight will be considered for a sign of osteoporosis, that is below 19 kgs. BMI of 19 kgs. So as it is the low bone weight, when the bone weight is also more, that is the body weight is increased, at that time also the person can be possible of developing a fracture. So both the body weight, plays the role in both low body weight and in the high body weight. Both will be taken into consideration for the fracture symptoms. And the next is the calcium. The calcium is required 1000 milligrams per day between the age of 18 to 50. This should be taken as a 50 milligram of your divided dosage per day, either as a diet or as a supplement. And next is the vitamin D. Vitamin D, as we saw, vitamin D improves the absorption capacity of calcium in the bone and improves the bone health. Next. Dietary changes will play the main role. We saw in the risk factor, the modifiable risk factors includes the low intake of calcium and vitamin D, which can be modified with the help of the dietary changes. So the diet containing the calcium will be dairy products like milk, yogurt, cheese, ice cream, cottage cheese, and fortified orange juice, and soya products. In the case of vitamin D, it is rich in fatty fish and few unfortified foods. The high source of vitamin D is possible with the help of the natural source of sunlight. Next is about the lifestyle modification. This lifestyle modification will also be considered as a modifying risk factors. We saw the sedentary lifestyle. When the sedentary lifestyle is changed to the physical activity, that physical activity can either be as a exercise schedule, when this exercise schedule will be helping in maintaining the strength. There should be the habit of doing regular exercises throughout the life. It should not be like doing the exercises in the beginning days of the life, and in the mid it has been left, and again as the condition occurs we started doing the exercises. It never helps. Throughout the life, when the exercises are followed, it gives the good health to the bone. And quitting the smoking, alcohol, and high caffeine intake will also improve the will also give the healthy lifestyle. And adequate exposure to sun. As we saw, vitamin D has a natural source from the sun. When we expose to the sun, the vitamin synthesis of vitamin D occurs, which helps in the absorption of calcium in the bone. So lifestyle modification will play the important role in the prevention of osteoporosis. Apart from this, fall risk. Fall risk can be corrected with the help of, when there is the fall risk occurs due to the sensory impairment, when we have the impaired eyes, or any with the help of the regular exercises, when the bone is getting strength, we can avoid the fall risk. So in the prevention, body weight, calcium and vitamin D intake, lifestyle modification, and fall prevention. All these things will play the main role in preventing the condition. Next. Exercises and the proper education to the patient. As we said already, regular exercises should be started in the early days, that is young age, and it should be continued throughout the lifestyle. And education to the proper education to the individual, which includes regular exercises, wearing a well-fit shoes to avoid the fall, regularly checking the eyesight, trying to avoid lifting the heavy lifts, following the healthy diets, which includes calcium and vitamin D. All this is a prevention of osteoporosis. Next. Now we are going to see the goals of the physical therapy. The main goal of the physical therapy is to educate proper posture, to prevent fracture, teach safe way of moving and lifting, how to increase the strength, to maintain and improve the balance, to improve the overall mobility, stretching the tight muscles, and to teach to control how to control the pain and gradually returning back to the regular activities. The main aim of the physical therapy will be based on improving the balance, improving the strength and endurance, and next regarding the flexibility of the bone. Next. Physical therapy management includes weight bearing exercises, flexibility exercises, strengthening, posture, and balance exercises. Next. Next. Before prescribing the exercises, we have to take into consideration that there are certain principles which is very much required before prescribing the exercise schedule. This general training principle include principle of specificity, principle of progressive overload, principle of reversibility, principle of individual value, initial value, principle of diminished return. The first one is principle of specificity. For example, we saw this osteoporosis commonly seen in spine, hip, and wrist. So whatever the exercises we are advising to the patient, it should be solely concentrating on these joints. It should not be like overall we are prescribing the exercise. It should be specific to the particular joint. Next. The second principle is principle of progressive overload. It is nothing but the loading stimulus must be increased progressively. For example, when we start the exercise section with a weight of 3 kgs, this 3 kgs weight should be gradually progressed. The same 3 kgs should not be given throughout the lifetime. So gradually after a month or after 2 months, depending on the patient capability, the weight should be progressively increased. Unless and until the progression is present in the weight, the bone never gets strength. Whatever the strength it is gaining, it will be withstanding as it is. So, and the third principle is principle of reversibility. This principle of reversibility is nothing but progressive loss. That is when the stimulus is discontinued. That is when the patient is advised for exercises, he will be doing a exercise for 2 months, 3 months, 6 months. At one stage, he will give a gap because of any personal activity. The exercise schedule will be left for a time being of 6 months. And again, he will be thinking of starting the exercises. In the initial 6 months when he does the exercises, he would have gained some strength in the muscle. That will be reversed, that will be lost due to the gap in the exercise schedule. So again, when he starts after certain period, again it will be like a day one progression. So this principle of reversibility should be taken into consideration and it has to be explained to the patient. And the next is the principle of initial value. Initial value plays the main role. Before starting, while starting the exercises, we should know the capability of the patient. When the patient is not capable of doing even a 3 kgs of weight, he couldn't able to lift, at that time we should not stress the patient to do the activity repeatedly. We should check whether 3 kgs is possible for the individual or 1 kg is possible or 5 kgs is possible. On knowing this factor, we have to start the exercises prescription. The fifth principle is diminished return. This principle of diminished return is correlated with the principle of cellular accommodation. That is, when the sections are progressing, when we are doing the exercises with the 3 cages and going on continuing with the same 3 cages, this accommodation will start occur. Whatever the strength has gained, it will be retaining as it is. More than that, the improvement or improving the strength is not possible if the weight is not increased. As we saw in the principle of progressive load, gradually the weight has to be increased. This 5 principle, that is principle of physicity, principle of progressive overload, principle of reversibility, principle of initial value, and principle of diminished return should be taken into consideration before prescribing the exercises. Next. Exercise prescription. There are certain trainings which we can apply for the osteoporosis patient, that is progressive resistance training, high velocity power training, weight bearing exercise training, non-impact exercise training, multimodal exercise training, and posture control exercises. The first one is the progressive resisted training. In this, it helps to it is like a strength training exercises which includes the own body weight as a weight, such as push-ups and squats. Apart from the own body weight, we can use equipments like dumbbells, free weights, weight cuffs, and elastic bands. With the help of this, we can instruct the patient to do the exercises. That exercises can be given as a 2 to 3 sets of 8 to 12 repetition for 2 to 3 times per week. I repeat, 2 to 3 sets of 8 to 12 repetition each exercise for 2 to 3 times per week. Next one. Next. High power training. This high power training has two exercise patterns. One is the dynamic weight bearing exercises and non-weight bearing exercises. Dynamic weight bearing exercise include vertical jump with the weight, vertical jump with the throwing medicine ball, or box jump. The box jump will be is a plyometry exercises. In the case of non-weight bearing exercises, it includes vertical jump without weights or throwing a weightless object with a maximum force, running and cycling. This high power training is not advisable for the older osteoporosis patient. Then why it is included in the exercise prescription? The reason is we educate the person to do exercises from the early days of the life and to follow throughout the life. So in the early days, when the individual is 20s or in the teen or in the 30s, it can be advised. This high power training can be advised to the patient as a preventive measure. These are all high impact exercises training which helps in developing the muscle mass, which strengthens the bone strength. So when the physical activity is peak during the bone formation, the bone will become more stronger enough to withstand the external stress. And the next exercise schedule is weight bearing exercises. Next, it includes two type of weight bearing exercises. One is a high impact exercises and the low impact exercises. High impact exercises includes brisk walking, climbing stairs, hiking, jogging, jumping rope, and sports activities like tennis. In the case of low impact exercises, walking outside, walking on a treadmill, step climbing, and low impact aerobic exercises. This, in the case of low impact exercises, step climbing should be 5 steps at a time. As a repetition, we can go either a 10 repetition as a 2-3 sets. It should not strain the individual. The impact should be very less to the individual. And next, non-impact exercise training. The non-impact exercise training includes Tai Chi, yoga, and Pilates exercises. It mainly focuses on maintaining the flexibility. By improving and maintaining the flexibility, the stress put on the bone by the tight muscle will be decreased and the ability to maintain the good posture improves. Good flexibility improves the mobility. Apart from this sort of exercises, we can prescribe some stretches to the area like hip, calf, and neck. Stretching to the upper back and chest helps in controlling the stooped posture. We saw in the clinical feature, like gradually the individual will develop the kyphosis because of the low bone mass. So this can be prevented with the help of stretching the upper back and the chest muscles. Next is a multimodal exercises training. This multimodal exercises training is nothing but combination of 2 sets of training program. It can include weight-bearing activities, weight-bearing exercises along with the progressive resisted training, or power training along with the balance mobility. There is no one sort of training that will be containing 1 or 2 training programs in the same schedule. Next, posture control exercises. It includes the extension exercises like spinal extension, chin tuck-in, scapular retraction, thoracic extension, and hip extension. All these exercises will improve posture, balance, and strength. The posture control exercises will concentrate not only on maintaining the posture, but also on strengthening the spinal vertebrae. Here, we have to take one consideration that while prescribing the exercises for the spine, we should not prescribe flexion pattern of exercises. This flexion pattern of exercises are contraindicated. The reason is it can lead to the anterior compression force to the vertebrae, and there is a plausibility of compression fracture. So, in order to avoid the compression fracture, the flexion pattern of exercises are contraindicated. We will be concentrating on posture maintenance, so the extension pattern of exercises is advised. Next. While doing exercises, we need the safety. The exercise safety is the do's and don'ts during the exercise schedule. The first one is we should not rush up to do the exercises too quickly. It can give the impact to the bone. The second one is exercises should be done regularly to get it benefit throughout the life. When we advise the patient, when they came to know their osteoporosis and advised with the or prescribed with the exercises, they will be doing for few months or years, and later on they will be giving some gap, and again they will be forgetting all the exercises, and again we will be visiting and for the getting the exercise. Like this, the interruption in the exercise schedule will never help in strengthening the bone. So we saw the principle of reversibility, that when we give the gap, the strength whatever gained will also be lost. So that should be taken into the consideration. And the next is to avoid the combination movements like flexion and rotation in the trunk. We saw the flexion pattern of exercises are contraindicated, so flexion and rotation should be avoided during the spinal exercises. And the next, prior to any activity, they should check whether there is a risk for fall. And the next one is in all the activities, the posture should be in a upright position. All this will help in the safety, as a safety precaution during the exercise schedule. Next. Coming to the conclusion part, we saw certain type of training sections. When we are prescribing like a multimodal training section, when we combine the exercises, the training sections like weight bearing exercises along with the progressive resisted exercise, or weight bearing with the posture control exercises, it will give more beneficial, because the strength training will help in strengthening the bone. Weight bearing exercises will maintains the bone for the lower limb to withstand the external strength, and balance exercises will help in maintaining the flexibility. Along with that, also controls the posture. So the combination of exercises will be more helpful comparing to the single prescription training program. As we know, this osteoporosis is a silent disease. So prevention is better than cure. So prevention, yearly deduction, and treatment plays the important role in maintaining the healthier lifestyle. Next. Reference part. Here there are few references, articles and journals which is supporting the present topic. With this, I conclude the section. Thank you.
Thank you so much, madam. Thank you so much for a wonderful session. Thank you so much for a wonderful session. It is a need of hour because we lack physical activities for past 4 or 5 months. So it is a need of hour. So to encourage our fellow physiotherapists also, it will be helpful. Madam, we will go for question and answer session, madam.
Yes, sure.
Yeah, participants from Fitness and Rehab India YouTube channel, you can write the questions in the live chat, and also from our participants in Zoom meeting, you can ask the resource person directly, or you can write your questions in chat box, please. Rupesh, can you please read out? There is a question. Rupesh, am I audible? Yes, okay. Rupesh, am I audible, Rupesh? Okay, I will read it out. The question is from Rutwa Pandya. Three questions are there. How smoking is a risk factor for osteoporosis? Second question is how hormones is also imbalance is also a risk factor, and how much physical activities are necessary to prevent osteoporosis?
Okay. The first one is risk factor of smoking.
Yes, madam. How risk factor is a smoking?
How smoking is a risk factor. Okay, smoking is a risk factor. The nicotine in the cigarette will leads to the increased resorption of the bone. resorption is the process where the calcium is taken out of the bone and transmitted to the bloodstream. Once this resorption start happening during the bone formation time, the bone loses its density. So it become a risk factor. The next one is?
The next one is how hormonal imbalance or hormones is also a risk factor.
Hormonal imbalance. Like we saw like estrogen deficiency. It is a hormonal imbalance which can leads to the bone resorptions. Only two things is mainly concentrated towards the bone formation. One is the bone formation during the beginning days, that is the early days of the life. During that time, there should not be imbalance in the hormone. If there is any deficiency, then this bone formation is not possible. So the bone formation, it's not reaching the peak bone mass, then resorption period, the next stage of resorption period in the bone started occurring and leads to the bone mass deterioration. And next one is a physical activity. How much physical
activities are necessary to prevent osteoporosis?
That differs from individual to individual. But a regular exercise schedule will help in preventing, because during the early days when we start the exercises, the bone formation will be supported. This physical activity will helping the bone formation. So there is no schedule like we have to do this much of hours, continuous sections. There is no slot, but regular exercises is required. We saw the principle of reversibility. According to that, when there is a gap in the exercises, whatever we have done in the previous section will be wasted. So regular exercises minimum for the period of 20 minutes of walk is also helpful. Next.
Okay, thank you, madam. Any other questions? Duna madam, any other questions in YouTube? Kindly check.
No questions.
Madam, I have a question, madam. You are talking about the principle of reversibility. Though, how many days or how many months is the duration for the reversibility, madam?
Sir, minimum of 15 to 20 days is okay, sir. But when it takes it more than a month, gradually the strength will be reduced.
Okay.
Because I have seen with the patient who has advised for the exercises, if he is doing the regular exercises and he is not leaving for 1 or 2 days, if he is leaving also, it's not an issue. Even to the 15 days, he is gaining the same thing. But when he is giving a gap of 1 month, at that time, when he comes back to the section and he starts doing the same weights, whatever he's putting on the exercises schedule, it's not possible with that patient. So the minimum period we can consider for 2 to 3 weeks. The maximum of 1 month will loosen the strength.
Okay, madam. Okay, participants, any other questions? Okay, we will conclude the session. Rupesh, Duna madam. Kindly check in YouTube. Is there any questions? We will address it. Otherwise, we will conclude the session. I think Rupesh audio is not working. Duna madam?
Yes, sir. I think we can
conclude. Okay. Thank you so much, Dr. N. Bobby. And I thank Priya, Dr. Priya, who is a student of you, who suggested me to reach you for a presentation. Thanks to Dr. Priya, and I thank ExRxIndia team members and all the participants from Zoom meeting and also from Fitness and Rehab India YouTube channel. And we are nearing to the world record. We are planning to set the world record on September 8th. And today's session is 190 by this time, and we will set a good number of topics, hours, and resource persons, count everything which will be counted inside. And thanks for your contribution, madam. Thank you so much. Thank you all. Bye bye. Good night.
Good night, sir.